Good afternoon, everyone. Thank you for joining us. I'm here today with my ministerial colleague, the Honorable Wayne Keynes, as well as Dr. Pete Ball, who is the Chief Medical Officer. Excuse me, it's been a long day. We are holding this press conference today to hopefully alleviate concerns that some persons within our community are having regarding Wednesday's arrival of the Anthem of the Seas cruise liner. Let me first start off by saying that the protection of Bermuda and our residents is of paramount consideration to the government and the Ministry of Health, and that is certainly our top priority. And we would never take any action that could put the health of our citizens and our community at risk. Therefore, let me say unequivocally, there are no passengers or crew on the Anthem of the Seas who are suspected of having the coronavirus. This ship does not pose any risk different from any other vessel arriving in Bermuda at any other time. The New Jersey Health Authority and the United States Centers for Disease Control have confirmed that the results were negative for the novel coronavirus among 4 passengers who were tested and were aboard the Anthem of the Seas on a previous sailing. To be clear, clearance by the U.S. health authorities confirms that there are no suspected cases of coronavirus aboard the Anthem of the Seas. The health of the passengers and the crew aboard this cruise ship have been carefully monitored and actively monitored with a declaration of health form which will be sent to the Department of Health for review by the Port Health Program. To further ensure the safety of Bermuda, as is always the case, health and port authorities will continue to apply careful control protocols as they always do at Bermuda's points of entry. And so before I hand over to the Chief Medical Officer, I certainly want to make it clear that the decision to reroute to Bermuda was made by the cruise line in order to provide a better experience for those passengers whose cruising time was shortened due to the late departure of the cruise ship. This was simply a logistical decision taken by the cruise line, and rumors to the contrary should be ignored. Again, please let me reiterate, protecting the health of Bermuda and her residents is of paramount importance to this government of Bermuda and the Ministry of Health. This includes taking steps that are internationally recognized and accepted to better ensuring protection of public health and serious risk with respect to the novel coronavirus or any other health risk that may befall Bermuda. So again, I need to reiterate that this is the priority of the government, is to ensure that we first and foremost protect our citizens, and that at no time would we be engaging in any type of discussions or allowing any cruises to arrive at our shores if there were suspected cases of the novel coronavirus on board. I'd like to turn over real quickly to the Chief Medical Officer, Dr. Pete Ball, who can provide further information, particularly from a technical point of view, and we also have technical teams from the Ministry of Health that are also here to stand by to answer any questions.
So I'd like to just add a few additional words about what we are currently doing within the Ministry of Health. I want to reassure the public that the Ministry of Health is working closely with stakeholders from different disciplines and sectors of society to plan and prepare for the global risk presented by coronavirus. This work includes very close collaboration with the Department of Customs, Department of Immigration, Skyport, and Cedar Aviation to enhance screening of arriving travelers and direct those with a travel history risk for further monitoring and assessment. Specifically, arriving travelers will undergo a travel risk assessment and could have their health monitored and movement on island restricted for up to 14 days. Those who have spent time in jurisdictions considered at very high risk will be given health instructions for follow-up and monitoring for 14 days. The public should know that there are officers at all ports of entry to assist with managing the situation, and port officials are in continuous communication with the Ministry of Health's Epidemiology and Surveillance Unit. Additionally, Bermuda's routine public health surveillance activities have been increased over recent weeks through the well-established collaborations between the ESU, or Epidemiology and Surveillance Unit, and the hospital, physician offices, and other health stakeholders. Enhanced monitoring of patients presenting with respiratory illnesses will continue, guided by recommendations from the World Health Organization and our regional authorities, Pan American Health Organization and Caribbean Public Health Agency, or CARPHA. Furthermore, the Bermuda government has put a restriction on direct flights from China, which applies to private or corporate aircrafts. Additionally, any visitors that have spent any time in mainland China in the last 14 days are discouraged from traveling to Bermuda and will be subject to risk assessment and necessary monitoring and restrictions. Likewise, travel to mainland China by our residents should be avoided at this time due to the risk of the novel coronavirus. Residents returning from mainland China will undergo travel risk assessment and may be subject to movement restriction and health monitoring, again for 14 days. The Epidemiology and Surveillance Unit and health officers assisting in the prevention and control activities for novel coronavirus are utilizing the guidance from the Centers for Disease Control and Prevention for conducting risk assessments on travelers. I can confirm that there are no cases or known suspect cases of coronavirus in Bermuda. To be classified as a suspect case, the World Health Organization has defined specific criteria that an individual must have. This includes a relevant travel history or risk of contact. It should be noted that the situation is extremely dynamic, and so the Ministry of Health is in continuous liaison with international public health agencies to address the evolving situation. It is critical for the public to turn their attention only to the established, trusted sources for health information. The Bermuda government website, the government Tree Frog app, as well as its Facebook and Twitter pages are the official sources of Ministry of Health information. These will be updated continuously as information is received and confirmed. If a case of coronavirus is confirmed in Bermuda, contact tracing will begin immediately and relevant individuals will be contacted by Ministry of Health staff. Any situation posing a risk to the safety of the general public will be communicated through official Ministry of Health channels. All local health updates can be found at the website gov.bm/health-data-and-monitoring. And the WHO website is a trusted source of up-to-the-moment global information. I urge the public to rely on official sources of information to prevent the damage that rumors can cause and the creation of false narratives and the diversion of public health resources away from situations that pose an actual threat to the island. Thank you.
Any questions from the media? For the broadcasting?
Minister, is there any truth that this ship was previously turned away from islands to the south before?
I'm not able to confirm or deny that. The information that I can say, which is based on the facts that we've been made aware of from the cruise line, is that not this particular sailing week, but prior to that, there were some suspected cases of persons that were representing flu-like symptoms. Following testing that was conducted by the authorities in New Jersey and confirmed by the Center for Disease Control, one of those persons that was tested had positive results for influenza. They did have a geographical risk because they had traveled or had been associated with some of the countries that we've spoken about. However, insofar as whether or not that cruise ship was diverted to Bermuda because other countries to the south refused their entry, we cannot confirm that. That information has not been passed to us, so I can't speak as that's a position of fact.
We've heard from bus operators and taxi operators who, despite what you've said, despite what the government has said, despite the vetting process by U.S. authorities, they're still deeply worried over picking up people from the ship. Can you say anything directly to them?
I'm going to just rely on one of my technical advisors who's actually been meeting with them, and will continue those engagements to help to alleviate their fears and educate them as to what exactly the actual factual circumstances are. Mr. Thomas?
Good afternoon. We just finished having a meeting at 2 p.m. with environmental health officers, branch pilots, and DPT was also there.
Can you share with us the concerns of the drivers and the response?
Yeah,
given
just
to-
like what you hear on social media, they had their concerns and opinions, and once going through the actual training and the learning of the virus, they were in a much better space now, which we're going to continue on working with the branch pilots and DPT as we go further. I can say the branch pilots were very concerned because they're the first line of persons that actually get on the board. So they're actually satisfied at this time.
Just one more question for the minister. and I'm done. Minister, the government's position is that there are processes in place for arriving passengers who will be subject to various forms of monitoring if they say they've been to China or the affected area.
Right.
Part of the trepidation is that this system is voluntary, meaning arriving a passenger has to be honest and say, I went to China. If they're not honest, the trepidation is that how will we know? Where were they before?
Right. Well, before I pass on to Dr. Peatball, members of the public should be aware that we have the Public Health Emergency Response Team, and this team meets very regularly, and of course in recent weeks have been meeting every couple of days. But this is a team that encompasses the Department of Corrections, Immigration, the hospital, and they are tasked with addressing circumstances like this. This is not something that's new insofar as this particular, the Public Health Emergency Response Team. They work regularly to address certain issues like this. Several years ago, we had Ebola, we've had SARS. So this is not something that's new. They're familiar with the protocols that are in place to ensure as best as possible the safety of Bermuda. Again, I'll let the Chief Medical Officer provide you with a little bit more of the technical information, but I just want to alert the public that this isn't new. The newness of this actually is the fact that social media has engulfed this particular exercise. And of course, when SARS and Ebola was present a couple years ago, we didn't have the extent of social media as we do now. But the Public Health Emergency Response Team is tasked with addressing certain things like this and ensuring that the protocols that exist in Bermuda are consistent with Public Health England and other international bodies such as PAHU and the World Health Organization.
Yes, just to add to that, Tara, I think the issue, the crux of the issue you're bringing up is one of trust, and whether or not the public feel that they are getting enough information and all of the information so that they can make decisions for their own safety. And the message I'd like to give is that the Ministry of Health's main priority is to protect the health of the people of Bermuda. And so information is shared as information is obtained, and I would like to reassure the public or certain sectors that are working on the front line with tourists and who have some concerns about the possibility of importing coronavirus to Bermuda that they will know almost the moment we know. We are not in the business of keeping back information that is a matter of public safety. They can be assured that the government website from the Epidemiology and Surveillance Unit, the rather arc website that I read earlier, and I will make sure that that somehow gets put up in places where people can see it and can go to that source of information or to the Tree Frog app. The point is that information that comes into us has to be verified, has to be digested before it is sent out, and it's very important that social media information not get ahead of the actual facts and evidence. And so I would just like to reassure anyone who's concerned about the risk that there is a risk to us every day, that this particular incident poses no special risk, that public health, the activity of public health and our collaborators is ongoing. It happens every day without fanfare. The effort to do surveillance for early detection of any problem that would be imported into the island or any problem that originates in the island. So the collaboration around detecting diseases and managing cases of it. That's always happening. And when it is a matter of public safety, that information will be shared immediately. I hope that got to the question that you were asking, but
Well,
it's important to share
I
that.
don't think you quite answered it. If I'm a passenger from New York City and I previously went to the region and I'm not volunteering that I went there, how will you know?
That part, yes. Public health relies on people having social responsibility. It is a well-documented fact that draconian measures, harsh measures only drive people's openness underground. They're not inclined to reveal anything if they think they're going to be detained or incarcerated or treated in an inhumane way. So it works against our best interests to do something extreme. We have to assume that there will be general honesty in situations where people expect to be treated fairly and are being treated and dealt with according to what's best for them, as well as their loved ones traveling with them, as well as the rest of our island. And so face it, what we have to accept that we are relying on people to be open and transparent with us, and in exchange for that, we assure them that they will be treated fairly and humanely and won't be stigmatized, and that there will be an appropriate sort of risk-based treatment of them, that it will be based on the risk that they are posing, and that anything we do will be evidence-based, that it will come from scientific evidence, and it won't come from our emotion and our desire to do something, anything, because that is what drives people underground and makes them not work with public health in a way that keeps us safer. It may seem counterintuitive, but that's the fact.
Thank you.
That's all right. Any further questions from the media? We're all set?
I just have one. Yeah, hi folks. Just one question, I guess. Did take a couple of calls from folks today about it, who said they were worried about the ship coming here because of the long incubation period for the virus. I guess folks worried that perhaps people may have it and be passing it on and not show any symptoms or not be aware that they're sick yet. I guess on behalf of folks with that concern, I just wanted to
Yeah.
see if we could address
Yes,
that.
a legitimate concern. The incubation period, we think, is at least 10 days, and so we suggest monitoring for 14, but the reality is that any of us who've traveled could be incubating the virus. The risk is one that we can't quantify, because anyone who's traveled to a risk area, particularly if you've worked as a healthcare provider or if you've lived in a household with someone who was a confirmed case of coronavirus, you could be at risk. But the fact is that, and it appears that until you're having symptoms, until you start to get sick, you don't pose a risk to others. So the public health efforts on island at the moment are to allow people to be identified if there is any risk, even the smallest risk that they could have been in an environment where there was person-to-person transmission of novel coronavirus, to be identified and to be monitored, a kind of self-monitoring in conjunction with support from the public health team at the ministry, so that during that potential incubation period, they are going to be quite alert to whether they start to get symptoms and whether they should be more stringently isolated and cared for. And in fact, as this progresses, I can't predict the future, but we would anticipate that as people travel and are exposed to others in other jurisdictions, that we will have to develop a system of informing individuals to be vigilant with their own health, to do a lot of hand washing and respiratory hygiene, covering their cough, to make sure they don't get sick with anything, but also if they've been in a risk area to be alert to the possibility that they could have been exposed to coronavirus, and to let their healthcare provider know that, so that they can be managed accordingly. So there is a huge responsibility on the individual here. Public health alone can't keep the island safe. There has to be individual effort and responsibility, as well as people becoming well informed of the symptoms. So as soon as you if you've traveled to a risk area and you get a fever or have shortness of breath or a cough, you should definitely be isolating yourself stringently and being in touch with your healthcare provider.